Good morning. I'm Margaret Fire Robin, serving on Bristol, Tennessee City Council, currently as mayor, and I welcome everyone and call to order this called City Council meeting of Thursday, April 30th, 2020, and welcome everybody who's here. We begin with Tara Music doing our attendance. Tara.
Fire Robin.
Here.
Kane.
Here.
Powers.
Here.
Lettrell.
Here.
Turner.
Here.
Thank you very much. And Mr. Sora, if you want to introduce staff and guests we have with us today, that would be great.
Yes, Mayor, I'd be glad to. From the guest standpoint today, we have Gary Mays, Director of Sullivan County Regional Health Department, and Dr. Stephen May, who serves as the Chief Medical Officer with the Health Department. In addition, we have Dr. Cedar joining us, along with staff Danielle Smith, City Attorney, Tara Music, Finance Director and City Recorder, Tim Beavers, Shane Barney, and Terry Napier, and John Luttrell.
Thank you very much for those introductions. So the next thing we do at every meeting at this point is to discuss the necessity for conducting electronic meetings. Danielle Smith, attorney, would you just go over that briefly?
Sure, I'd be happy to, Mayor. As you've heard me say several times now, we are conducting this meeting electronically in accordance with the Governor's Executive Order number 16, which suspended some of the provisions of the Open Meetings Act in order to allow governing bodies to meet electronically versus physically. As long as you all decide that there is a necessity to meet electronically in order to protect the health and safety and welfare of Tennesseans, then that should be okay under the Governor's order. But you do need to make that decision at every meeting, and that should be reflected in your minutes. And so at this point, if anybody does not agree that an electronic meeting is appropriate, then they should probably have the opportunity to say so.
All right, and I'll just ask, are we all in agreement? And everybody nods or says yes or
Yes.
Thank you very much. Appreciate it. So today I'll let Mr. Sora introduce, but we have been very appreciative to have Gary Mays, Director of our Sullivan County Health Department, and Dr. May join us quite a few times during this pandemic, and we really appreciate the time that you can come on to our Zoom meetings and give us updates. So Mr. Sora.
So I would echo the mayor's comments. Both of you have been very, very generous with your time, and I know you're working 24/7 now for probably close to 8 weeks, I'm sure since the middle of February. And we really appreciate your contribution to our community and how you've managed the disease. And then certainly your willingness to engage all of the governing bodies and provide them with status updates on a periodic basis. With that, however you all want to update council to proceed, whoever wants to go first with that. I'm sure before you leave the meeting, there's certainly Public Health Order number 3. You'd like to discuss that and make that presentation to council also.
Sure. Thank you, Mayor Fire Robin, and especially thank you for your kind comments, and thank you, City Manager Bill Sora, for your kind comments and our working relationship with the City of Bristol, and to the Bristol City Council, of course. Thank you for inviting us back. It's always an opportunity for us, and we think it is important for us to communicate our public health activities for the citizens of Bristol. And before I kick it over to Dr. May to talk about our disease status, I want to let you know that today we're actually at the Cedar Center, and for your citizens that are listening, you can call our appointment line at 279-2777. However, if you don't have an appointment, don't let that stop you. We have process for working folks in, and just go to the Slater Center, as many people as you want to put in a car or a van safely, wearing a mask, I hope. And we will be glad to accommodate you for a COVID diagnostic test. And that is no charge to those that participate. And we have a very competent team up there that is ready, able, and willing to serve. I'm not sure today, but we may be supported by National Guard troops. I'm not sure on that one yet. But anyway, we have adequate staff there to deal with that. Also, I want to take this opportunity to publicly express my gratitude and appreciation to all the team at Sullivan County Regional Health Department. We have taken thousands of calls, certainly since this began, hundreds of calls just this week, along talking with businesses, the business community, entrepreneurs, concerned citizens. And I think our team is doing a great job. We've tested well over 1,000 folks in Sullivan County. I think we're at 1,300. Dr. May will elaborate on that and correct that number. And I've just not had time to get the latest update on all the numbers. But I do appreciate our folks at Sullivan County Regional Health Department and the hours they've put in and the huge support and teamwork effort that they've put together. We get a lot of positive customer feedback, if you will. Clients coming through our testing centers, the worried well that have called the health department just to talk to a nurse to get some information and comfort about the disease and things going on, business guidance from Barry Honeycutt at the health department, and of course, Dr. Stephen May, who is Sullivan County's Dr. Fauci. Someone mentioned that to me yesterday, and I think that's a great description. Dr. May is putting long hours. I'm having to handcuff him and put him in his car and force him to take a little personal time and get some sleep. And so he's a hard worker. I didn't know anyone could work as hard as me, but Dr. May is definitely outdoing me. So very thankful. And again, thankful to the Bristol Council for inviting us. But if I may, Mayor, I'll ask Dr. May to comment on our update and public order number 3.
Go for it.
All right, just to give you kind of a national picture, a state picture, and then a local picture. Nationally, when we look at major hotspot areas, it appears to be plateauing and death rates may be starting to downturn, which is all good news. The death rate for the nation continues to be at about 5.86%. Looking at Tennessee, we've been much more blessed. We're at actually 1.88%. And with the massive increase in testing across the state, our positivity rate for the state remains at 6.1%. In Sullivan County, we have 49 cases at the present time. 43 have recovered. We have tested 806 in the last 2 weeks just through the drive-through. We're approaching 1,300 total tests as of today. About 20 contacts we're still doing active monitoring on. You'll start to see a shift in our testing strategy over the next week. We're going to be shifting from random drive-through testing, random testing, doing more targeted testing, looking at our vulnerable populations, so particularly nursing homes, assisted livings. We're going to try to be doing a lot more focused testing in those areas to be sure we're keeping those places safe. A word about antibody testing, which you're going to be hearing a lot about. There is a lot of confusion and lack of understanding of where these antibody testing strategies will be going. Currently, there's only 8 approved FDA tests in the United States, and a number of the other tests, of which there's over 70, are having difficulty with accuracy. The other thing is we really don't know what this test tells us. Does this tell us do we have immunity or not? That is unknown. So at present time, our main strategy remains focused on disease detection through PCR testing, looking for the actual virus, along with case investigation, and then contact tracing, placing in isolation and quarantine respectively. So that's really important to understand. So you're going to hear a lot of stuff on the antibody testing. I think it's got a long ways to go before it becomes a useful tool and we start really using that here. Our public health order number 3 basically is coming out today. Basically, it just says we're going to be mirroring and working with the governor's office with the Tennessee's pledge. The governor will be relaxing dental procedures effective May the 6th. And the anticipation is also personal care services may have relaxation of their services and opening up on May the 6th. Of course, each of these areas will have their distinctive guidelines that they'll need to follow, and everyone needs to be following the universal guidelines, particularly with the social distancing, wearing masks, and protecting themselves, and especially protecting our vulnerable. And I did mention our shift in focus from testing now will be on those most vulnerable, and of course on those who have any type of respiratory symptoms. We'll want to get them tested. I will be sending out today some travel guidelines since we're moving now into phase 1 of our recovery. I've revised the travel guidelines and we'll be glad to share those with your human resources personnel. That's all I've got today, Gary, and the team. Thank you.
Thank you, Dr. May.
Okay. So a couple of things that just strike me besides the health guidelines the governor has in our first Sullivan County order had overall guidelines for individuals, employers, and employees, and then specific to the different genre of businesses as well. So those are included in those in the governor's pledge and that information. So before people start asking questions, I just wanted to follow up a little bit for the contact tracing, and also how can we help, how can our business community help to make that easier should somebody test positive?
Well, in the guidelines, when you read the specifics, it does talk about, for those who do see lots of people, particularly in the personal care, they're going to need to keep a log along with instituting those social distancing measures, particularly wearing masks on both parties while doing the work, minimizing contact, of course, the disinfection practice, and maintaining that 6-foot distance, limited appointments, keeping maybe only 1 or 2 people in the facility at a time. In the commercial and retail, of course, they've limited capacity to 50%, but it really doesn't matter what the number is, as long as you maintain that 6-foot spacing and encourage the wearing of masks. Now, that's one thing we are noting. People are, just from what we're seeing, are not real attuned yet to wearing these masks out in public and when they're in groups. We are still limited to groups of less than 10 in any type of gathering. Of course, in businesses, you can have more than that, but we're not seeing the good social distancing we would like to see. And we have to remember, we cannot become complacent with these measures. If we don't follow these measures and continue to do a good job as we have been doing with the social distancing, we can truly anticipate to see increased spread of the disease. And we want to make sure that we stay within the capacities of our healthcare systems.
Thank you. And for those logs are critical with, if someone turns up that is positive who visited your personal care business or whatever, then that helps tremendously. And it helps to know which employees were there at the time, et cetera. Is that correct, Dr. May?
Absolutely. And then the other critical piece is, were they using their protective equipment and the social distancing? Looking at being closer than 6 feet for greater than 10 minutes is actually what defines a true contact without any type of personal protective equipment. Of course, we continue to monitor for symptoms. If you are defined as a contact, we, as a public health department, will do that investigation and continue to quarantine those who are defined as contacts for 14 days.
Right. So that makes it easier if that is, if folks have that information. And with our still lag in development of symptoms, lag in testing, that can be a week later, 2 weeks later. So depending on our memories, doesn't always isn't as effective with that lag in time. So, okay. Council, do y'all have questions for our
I have
here,
one.
folks?
I have one on the 1,300 test. Is that test that the health department has done, or is that combined with Ballad and any other testing that's done, or is that just from the health department?
That is just from the health department, but we also have to remember sometimes these numbers lag in that we have to get those reports and get them into our reporting system with the state. So the state numbers may actually lag the actual true numbers that have been performed.
Right.
And the state numbers include the total or just health department numbers?
The state numbers include the totals.
Okay, so
And
the
if I may
total
add-
positives and the total tested.
Total tested, yes.
Right.
And I may add that our testing rate per population is on par where we should be for a county our size. And I want to add as well that the design and process that we use is very customer friendly. And they don't have to wait exceedingly long times like you see on the national news at some testing centers, and I attribute that again to the process and system design and execution of our staff.
Okay.
Yep.
All right.
Dr. Mays, you had mentioned that 5.8% of those tested was the national number for the death rate. 5.8%, is that of those that were tested specifically?
That's of the known cases.
Okay.
So the people were tested, they were tested positive. And then looking at the overall death rate with it is 5.86% of those who we know had COVID in the United States.
There may be some confusion because a lot of times people hear statistics and they think that it's related to the total population, not just of those that have been tested. So thank you for that clarification. You had mentioned random testing, especially in our nursing and rehabilitative care facilities. All of that testing, is it voluntary?
Yes, the testing is voluntary, and the testing will be provided for free through the state system.
Okay, great. Good to know. And then, Gary, a question that many have approached me about is, you know, in regard to where we've been, and I think maybe we had talked about this before. Dr. Mays, either one, we are in phase 1, and so that is a formula that's put together based on the declining of positive cases and in our healthcare system's capacity. When did the clock start ticking on phase 1 before we could be considered going into phase 2?
Yeah, it's a great question, and I can, I don't know the answer to that. The Tennessee Department of Health has not conveyed to us when that clock started ticking. In other words, when the case count began. It seems logical, in only my opinion, that clock began ticking when the governor issued the first announcement of the phase 1. But that could very well be, if you read the Opening Up America Again guidelines, that could be a rolling calendar. In other words, it says 14 consecutive days. And so that in and of itself allows, if you have a bad week, for an example, that week has to roll off and then you go for 14 consecutive days again.
Correct.
So that seems very logical. I haven't heard anyone explain it that way, but that appears to be the best way to go about it. And you can look at the Tennessee website and closely monitor the state trends and where we are.
Well, I know our local trend beginning April 15th, we were at 9.3 positive testing. And as of yesterday, we have systematically and gone to 3.7. There was a day or two in there where we had a plateau. So, you know, we have accomplished 14 days already. So I was just wondering when that would begin. And also, the main reason that we had the lockdown, either one that would like to speak to this, was so that our healthcare system could handle capacity and surge. Where are we in regard to our healthcare system being able to handle capacity and surge?
Okay. Now, thank you for that question, and it's an important question. When we began this, and it seems like a long time ago, but when we began this in February, there were a lot of things we didn't know. Moving that forward to what we know today, we can say that the lockdown had a very positive effect on our community, and our citizens, I think, have done an outstanding job, our business community, and we appreciate our numbers very, very much. Now, going back, we did not have access to adequate PPE in February for our first responders and our hospital personnel. We did not have adequate ventilatory support or mechanical ventilation support for the hospitals. We did not have the projected surge capacity that other parts of the world were seeing. So what has happened during this lockdown is we have more PPE. We do have ventilatory support that should be adequate. And we've learned a lot more about the disease from a science standpoint and a treatment standpoint. And so we are in a much improved position to deal with the disease should the case number rise and sickness raise. And so we are in a better position. And that, of course, is why we're seeing these phased in openings all across the country. One, to get the economy back and so on and so forth. And should the disease become much worse, it gives us a little more authority and power and equipment and needs to deal with it. Now, is that adequate? We don't know. That part is still unknown. I think we may have a better picture, as Dr. May has said many times, we may have a better picture about where we'll be in about 3 weeks. And we have no idea really what is going to happen in the fall. And so, but we are tooling up and we're tooling up internally, improving our capacity for contact tracing and cluster follow-up, which again, the shutdown has given us time and preparation for that. And so we're doing everything we can to continue to work hard in response to the disease should we need to. Did I answer your question?
You did. You did. The bottom line, as I heard it, is that we went into a safer at home declaration to allow our healthcare system opportunity to tool up in preparation for a surge and to hold everyone at bay to try to control and maintain the disease as best we could. And I think that's been accomplished. Dr. Mays, do you think that that's been accomplished to date?
Oh, absolutely. In that, when you look at our numbers, we've actually been at a plateau for about the last week and a half. I mean, we were 47 a week ago. We ticked up to 48 2 days ago and 49 today. So when we look at that rate of rise, it's actually minimal when we look at our true number of cases. And the other thing that's reassuring is when we look at the drive-through testing, these 800 tests that we've done, we were only able to pick up one positive case circulating in the community when we were testing a lot of asymptomatic people. Now, the one person that did turn out to be positive was symptomatic with symptoms. They were mild symptoms, but symptoms nonetheless. So I think that gives us a good indication that it's not widely circulating within the community at this time, where I think we would have had a lot more positives with our drive-through testing. And that's another reason we're shifting our focus into looking at these targeted high-risk areas to be sure that it's not getting into those facilities where we have the most devastating results and outcomes if they get COVID-19 within that population.
Thank you so much.
And if I may continue on, just one more comment, and I asked Dr. May to correct me, but one of the things that we learned in Sullivan County back in the early days, maybe in February, March timeline, we learned that most of our cases began as a result of travel and came back to the community. And so we really don't know, but we suspect that our case we may repeat that cycle again as our economy gets hopefully back online and business resumes and folks travel. We suspect we could see a repeat of that. Now, what is important is this continuous message of washing your hands, being safe, and wearing a mask, and so on and so forth. I know the public's tired of the message, but it is the message that can keep our community safe as we go about our normal lives. Apologize for protracting the discussion.
If Director Mays, you used a terminology, just want to be sure that people understand it, talked about contact tracing and cluster follow-up. Can you explain the cluster follow-up so we're clear on what that is?
Right, that is a fundamental public health function that I feel our team is very good at. And it is basically when someone becomes ill with a particular disease, COVID, of course, is what we're talking about. Each person that case or patient came in close contact with, we need to follow up with them to see if they're sick and isolate them. And if they're not, we follow up with them every single day, in every contact, in every case. We make contact every day, 7 days a week. And so that is a very important process in that we do to contain the disease. A cluster, for an example, could be a fixed facility such as a hospital, medical practice, nursing home, where you have a case, an index case, and then you have multiple people that get sick from that index case, and that would be a cluster. And again, the same process is isolate, make follow-up contact, treat as appropriate, and isolate the disease from the public. And that is fundamentally our approach for the health department to protect the citizens of Sullivan County over these next few months. It's a resource-intensive process, but it is a process that's worked for decades. Is that a fair summary, Dr. May?
Yes, and the importance too about a cluster investigation is if we identify it in a certain facility, it allows us to put in special measures, operational procedures that may be necessary to help control that disease within that facility. And it allows us to target and focus those resources when we define it as a cluster.
Thank you. Also, just a little more talking about masks, because I think on the internet, there's lots of different messages. People read different things. Also, at the beginning, masks were not deemed as important. So if y'all can just talk a little bit about the function of wearing a mask and the importance of general folks not purchasing the heavy duty medical grade masks at this point.
Okay, when you look at the proper usage of mask, the mask is designed to protect you who may be asymptomatic from infecting someone else. So you're protecting your neighbor, your colleague, or whoever you're close to. When we have masks on both parties, then we're able to decrease that rate of transmission, and that actual zone of infectivity that is up to 6 feet is cut way down when wearing a mask. So with the sneeze, particles can go 6 feet or even more. If you have a mask on, those particles can't go very far at all, less than a foot. So the methodology is to ensure that we protect people who may not recognize that they're shedding the virus from transmitting that virus to other people. So the mask is to protect your neighbor, not necessarily to protect you. And so it's important that we understand the difference. And there's a great graphic I'll be glad to send to the council that would be great to put on your webpage. It shows the transmission different distances between one wearing a mask, both wearing a mask, both doing social distancing, and then one staying in the house and the other outside. I'll be glad to share that with you, and I'll send that to you via an email.
That would be awesome, because yeah, and I think with the recommendations changing during this time, it makes it harder for people to understand what's right. And I have heard people say they do good practices of using their elbows so they don't need a mask, and some different things along those lines. And I think that the recommendation, I believe that's now CDC is recommending that, and public health is recommending, is that correct?
That is one of the universal precautions that we are trying to get people to comply with. Anytime that they're out in public, they should be wearing a mask.
And I'll just point out in the overall guidelines, I believe for the businesses, that is what employers should be providing for their employees, and employees should be following the directives and wearing those masks. So unless they're in their office isolated or whatever, but if they're working on a floor in a retail or whatever.
Now, on the subject of masks, we also want to be sure for the general public who's not working with high-risk populations and, not in people's mouths, such as in dental procedures, not intubating people that may be high risk or ill. Regular cloth masks are all we really need, or any type of cloth covering. We really want to reserve the surgical mask, the N95 mask, for our healthcare workers who are on the front line, literally in known sick people's faces. And so we must protect those healthcare workers, so we've got them to serve when we really need them.
Thanks.
So in being cautiously optimistic, everything in place, following all the protocols in phase 1, what does phase 2 look like?
Phase 2 means larger groups in venues. If I recall correctly, it's 50 people instead of 10. There is more relaxed guidelines as far as social activity, bars and things of that nature. Phase 3 looks more like before COVID days. So it's important. We want to move to phase 2. We want to move to phase 2 rapidly. That will help us in many ways economically and help our citizens. Phase 3 is, I believe, when we can open schools, and then that sort of looks really like normal life again, and we hope to get there. It's unknown, so I think the next 3 weeks are important for us.
So the point of my question, and Gary, you've done a great job of addressing it, is that we're all anxious to get back to that point of life as normal, but we can't get there just by adopting our lifestyle prior to COVID. We can aspire to that, but it's so important that we do adhere to the CDC guidelines that y'all have reiterated over and over again, and that I greatly appreciate. And so for us to get to where it should be, it's in the hands of all of us, of our citizens, And if we want to move forward, we've all got to move forward. It's become overly used, but we've got to move forward together using these best practices. And if we do that, if I understand correctly, we have the opportunity to get back to where we want to be even more quickly. But it's dependent on those individual behaviors.
Yes, concur 100%.
Well, and one thing I think for everyone listening, will you just go over the fact, I know with the new Order 3 that's coming out, because there's been a lot of confusion with the 89 counties and then with the other 6 counties, that the new order is going to follow and mirror the governor's order. And then as we go along in these phases, will that also be coming from the governor's office? Will that be for our local numbers here in Sullivan County? Or how is that going to work of going forward? Are we going to just mirror the governor from now on, of as far as if he moves to phase 2, then we would move to phase 2, just so that everyone is, because I know there's been a lot of confusion over this, of just
Yeah. And
I
thank you for that question. There is, and we've heard that loudly. And so you're correct. Of course, Dr. May signed Public Health Order number 3, and that is in public locations now, and will be throughout today posted. But you're correct. We are mirroring what the state of Tennessee, the governor, is doing in terms of executive orders, what business can open, how that business should practice when it opens. And it always has been, since the opening of America from the federal guidelines, it always has been a governor's decision as to which phase they move into. Now, the federal oversight has guidance there, and folks working with the governors in order to make sure that they can qualify for phase 2 or 3 or even phase 1. So Tennessee is in phase 1, and so it behooves the state and all of us as a region, each one of us, to keep the numbers in disease cases in the right direction, in a trend in the right direction, so that we can progress through the phases. And so we will be in lockstep going forward with the governor and his executive orders, with the number one intent of that is to minimize confusion to our citizens, and also improve the process in our discussion. Business and entrepreneurs, they want clarity, and they're very innovative, and they're smart folks, or they wouldn't be in the business they're doing and running a business. They just want to know what rules they need to go by and how to operate their business. And so we believe this is a better approach. Our first order was not very different than the governor's first order. There were some things that we allowed to happen because of our case numbers were in good shape. But we think, for the sake of consistency and messaging and continuity, and we've had a lot of success as a region, and we think that's the best approach forward. But thank you for that question.
Thank you.
Gary,
Also, I'll
Gary,
just
there was an
add,
interpretation.
hold on 1 second. That the governor's task force that's been working, I don't know whether they will continue for offering some guidance for phase 2 for those businesses that or activities that are not allowed yet in phase 1. It certainly would be helpful, so hopefully they are considering doing that as well. But I think the clarity, the work that's coming from that task force adds to what the governor's doing with being real specific, and that individual health departments, that's difficult to do that work that's been done with representatives across the state and across business genres to try to give more specific directives that are helpful to businesses to know, and also have the backing of the state in that work to feel confident going forward that they're following those. So I think that also plays a big part in reason to follow the governor. Also, I was before Malin jumps in, is Nashville, I know they were a little behind and had not declared being in phase 1 yet. Are they closer to phase 1? Have they declared that? I have not followed the last couple of days.
Nashville phase 1.
They are?
They are.
Okay. I know they were a little bit behind because of the rough time they've had. So, okay, Malin.
Yeah, Gary, if there becomes an interpretation issue as an individual is looking at these new guidelines, should they contact your office or should they contact the governor's office for any clarifications?
Yeah, another good question. All along, one of our responses from the beginning, we, excuse me, have staff who have a good entrepreneurial background and a clinical background, taking business calls, trying to offer them advice and explaining the guidance, not telling them how to do their business or how to be practice their business, but to offer interpretation and advice on the guidance in the publications. We'll continue to do that, but they can call, for Sullivan County citizens in business, they can call the health department. We'll try to provide that assistance as long as it's needed. But they can also go to the Tennessee governor's website and read those executive orders and Tennessee pledge for themselves. They are pretty exhaustive in their explanation, and some areas need a little more detail. And so we're working with the governor's office. I know the mayors have meetings with the governor's office, and we're also in council with our colleagues across the state for continuity. So we're really working together. We don't have 100% of the answers 100% of the time, but we're doing the best effort. And I will confess, this is the first time we've ever done this, and so we're getting a lot of experience, shall I say, in this process.
Yeah, I believe we're all in that boat.
I would just follow that with there is a lot of information in the governor's orders and in those individual, like the one that came out on gyms. There's a lot of information in that, some of the other guidelines. So I really encourage folks, if you have a question, to try to look at that and see if that does answer your question before making a phone call. There are also areas of shades of gray that are difficult for people to navigate. So anyway, but there's a lot of information that is being provided that answers questions if folks will check it out on the governor's website. The state website. Other questions?
Let me qualify what I said about Nashville. Nashville has had some openings. I don't know that they are officially in phase 1.
Okay. Yeah.
Some food venues have opened as of Monday. So
the malls are opening this weekend.
Okay.
I saw that yesterday.
Thanks. Okay. Any other questions? And if not, just being sure that I got it.
Doing, and I think this is, I think I'm going with following the governor, that it'll make it a lot easier for our citizens and our businesses to, so I thank you both for that.
Thank you.
Yeah. Thanks. All right. If there are no other questions or for Dr. May and Director Gary Mays, we thank you very, very much for your attention to us and opportunity for us to have discussion, answer questions, and we also hope this is helpful for our citizens who do catch this. And my guess is some of them catch y'all and turn us off after that. So appreciate that very, very much for your time. So
thank you, Mayor.
Thank you very much. All right. So I think we have city manager comments, but we also have Dr. Tudor here, who I would call on first if she has anything to add. We visited with you last Thursday about Vance, but if you have anything else you want to add today on school system, that we appreciate so much.
I don't actually have any new updates other than just to draw your attention to next week is Teacher Appreciation Week. And historically in our school district, we recognize all staff, not just teachers, in terms of their devotion and dedication to our school district. And this season is even more important than ever. So you'll see some social media posts and opportunities to recognize teachers and staff across our district. So just draw your attention to that. Also, Nurses Day, National Nurses Day is Wednesday of next week as well. And so, of course, we'll recognize our school nurses who have done a lot to support our children, certainly in normal circumstances, but also in our school closures. But we are also very appreciative of all the service that nurses in our community are providing to our community members, certainly in Sullivan County. So just draw attention to those things. I don't have a specific update unless you all have questions for me.
I'll just add to that. I have served on the Education Foundation, and I believe they have a donate button on their webpage. That group has talked about advocating for teacher appreciation, or different times for gifts could be through gifting to the foundation. Our teachers, we have a program, teachers write mini grants for small amounts and bring those to the foundation, so there's opportunity. So I encourage people, if you're not able to thank a teacher in person or give that card, or I used to try to get Scotch strawberries for my teacher appreciation, that you can help the school system, help our teachers, help our schools by donating through the Education Foundation. So thanks for that opportunity. So,
Dr. Tudor, I've got a question. I know you mentioned at our last meeting about the potential of a graduation sometime during the summer, I think after the 4th of July, I believe is what you mentioned. But there's also been some talk about prom, and I know that I've been approached from both sides of town, actually from Virginia and Tennessee, by parents. And is the school system going to try to get involved in anything like that, or what's your thoughts on that?
Well, so first of all, let me speak to graduation. We had a plan, and we're moving in a direction of doing a virtual type celebration in May. And we then surveyed our seniors, and we got some feedback from them. And so we actually, when I get off this call, we have a graduation meeting this morning to decide what direction we're going to head in. So it may or may not be virtual. It may or may not be in July. Those conversations are still up in the air. But yes, we are planning something. And it may be multiple somethings. It may be we do something now because we know we have some students, for instance, who are enlisted in academies and would have to leave the end of June and wouldn't be able to participate in something in July. And so we're trying to accommodate all of those needs as best we can. So hopefully we'll have more information publicly. We can notify the public about that in the next coming few days, maybe the beginning of next week. In terms of prom, yes, there has been a group of folks at Tennessee High School who have been working on that for a while now. We are committed to doing something, but with recent information this week, it's really kind of impacted a lot of what we were potentially planning for June anyway. And so I don't feel as though we can do anything in June that would bring any number of groups together physically. So if we do anything for a prom type celebration, we'd have to look out toward the future, and we certainly would follow Sullivan County Health Department guidance and where we are in terms of those phases before we would do anything about bringing students together in any capacity for that. And so it could look like something as late July even before we're able to do that. If we are able to do that, we don't even know if we'll go back to school in August. You know, all those things are just so unknown. So I can say that we are committed to doing something, as I've said before, and we are looking at lots of options, but the safety of our staff and our students certainly is our number one priority, and we would not want to put anyone in harm's way or risk their health by pushing it, you know, and doing something that's not going to be in the best interest of our community. So we're looking at options. I know that doesn't really answer your question, and it's not certainly what people want to hear. People want a date and a time and you know, specifics, and unfortunately we just can't do that any better than anyone else can in terms of how we're going to open up and be able to get back together over the coming weeks.
Yeah, I think from the guidelines in the phases, it would mean we need to be in phase 3, and it's a catch-22. We just don't know how quickly we can move and whether we get setbacks to move forward, and so that just makes it really, really difficult for everybody planning those important events and weddings and reunions and anniversaries and all those things that are so important to families and communities. And it's just really, really hard on everybody and businesses that depend on those kinds of events.
I'll ask this question to anybody, probably Margaret or Bill, one of the two. If in your conversations with the other mayors, and I know you guys have done some in-depth conversations, my question would be, if we were to progress along the same status we are right now, things continue to get better, we don't have any spikes, what is the ballpark time that we're talking about if things were at their very best to get to the phase 3? Has anybody mentioned a timeline at all?
I haven't heard any discussion along those lines at all. I think everyone is in the implementation phase of the governor's order, and we'll see where that takes us. Much like Dr. Tudor mentioned earlier, we just don't have that crystal ball that we can predict a timeline. The virus is still with us. It hasn't gone anywhere. And that's the reason there's so much emphasis on the protocols that the CDC has put in place to try to mitigate the virus from spreading again. So I don't think there's anyone out there that's ready to call a timeline for phase 2, phase 3, or anything that looks like that. Margaret, do you have a different?
No, I was just going to say, I think as we're opening up, we'll be able to tell a little bit in the next couple of weeks, but everything's so delayed. So with how long you can have it before you have symptoms. So, but I think we hopefully will have a little better idea getting into the warmer months. There is thought that the disease will quiet down during the summer. So whether we see that happening as well. There's also some of the information and articles talk about rural areas being up to 2.5 months behind the urban areas. And, you know, sometimes we're in our area are considered urban, sometimes we're considered more rural. So whether we are behind other people, whether it's because we've done really well and going to continue with that, or whether it's because we're just lagging behind other areas. We just don't know that. But Chad, we can start asking about that and, you know, start looking at what's ideal or whatever if people are having any thoughts. But again, I think across the state as things start opening up, that will help to think about that timeline better than where we are right now with just starting to open up.
Pat, to your question, I did call the health department yesterday and I did ask that question. And again, as has been stated, there is no crystal ball, but I was told that we could expect to be in phase 1 for at least 3 weeks moving forward. And that each additional phase we could, if we successfully made our way through the phases, we could look for each phase to last anywhere from 3 to 4 weeks. But that was with no spikes, with no walking backwards. And these were just best estimations. They weren't absolute, but that we would be in phase one for at least 3 weeks.
So phase
And that came from the
3
health,
weeks, 3 weeks starting this past Monday then?
at least.
Okay. You know, one of the things and Bill, this is probably directed in staff, you know the questions that we're being asked. And like I said, I've talked to folks from the Virginia side of town as well about, you know, their ideas and that kind of stuff. Are we just in a situation where we just don't know and we really can't respond to what parents are asking for, or how's the best way for us all to handle those questions that they're asking?
What, I guess, what questions are you being asked? I guess.
Well, we all got emails from parents about wanting to close State Street for like 2 nights. One night for Virginia High School, one night for Tennessee High School. You know, it was around the sign area. You know, that type of thing is what I'm asking.
I think the larger question here is when does the Department of Health feel like that's ready? And I don't think that's predicted right now. So I would, to answer to all of those questions, I would look to the Department of Health and the data that they evaluate on a continuing basis to guide the response to those decisions.
Does phase 2 move us into an area where more than 10 people could gather for some sort of, or is that only in phase 3?
No, phase 2 is 50 or below.
Phase 2 is 50 or below.
Right. Right. Yep. So it's not to, and it also isn't until phase 3 for vulnerable populations to stop being safer at home. So that's also thinking about graduations or whatever, if you are hoping to have relatives participate or whatever, that older populations or people with health conditions are recommended to basically stay home as much as possible until phase 3.
Okay.
So it's tough stuff.
Well, I guess
Dr. Tudor?
Yes, sir.
I guess
Dr. Tudor, I think your thoughtfulness and consideration to those questions, I think you're very well on point, and I commend you for your thoughtfulness on that.
Thank you. It is tough, as Margaret said. It's hard to make those calls, and it's hard to say no, because we want to celebrate our kids very much and allow them those opportunities. So it's a really hard thing to do, but their safety is way more important. Thank you.
Well, I think too, we'll know more of as it goes, and if following the governor's office, then it may be stepped up. The governor's office, we may move to phase 2
Right.
sooner, and so I think that you know, try to have some plans, and you have to have the plans, but also waiting to see what comes out of the governor's office and where we are before making those, you know, definite plans. I mean, I know you have to plan for it, but setting a date, I think we've got a little bit of time of seeing how it goes in the next couple of weeks to make some of those decisions, and we may see some changes.
So I would, just like in event planning, I think so a lot of times people do different scenarios. What if it rains, and what if, you know, just the what if. So as the folks think about larger gatherings, whether those are personal or looking at our school system or whatever, is trying to look at scenarios. So try to work through and maybe have not detailed plans, but be thinking, be creative, that if we can't do this, can we do this? And not depend on one plan, because even if things are looking good, plans go ahead 2 weeks before, a week before, 3 days before. We could have major number of positive cases or whatever. So just trying to be flexible, but thinking through to be creative. What are some scenarios that we need to be looking at, and how can we address those? So this is challenging. Where we need all that entrepreneurial and creative thinking at this time to really work those brains to be able to do that.
Danielle, I have a quick question for you. You know, we've been able to meet electronically. When does that opportunity end, or is it to be allowed through the continued phases of the governor's plan?
I'm not aware of any guidance on whether it's going to be allowed through the continued phases of the governor's plan. Currently, that executive order expires on May 18th. And so we'd have to wait and see. And hopefully the governor would issue something a few days in advance so that there's some planning. But right now, May 18th would be the last time. And actually, I think it's 12:01 a.m. on May 18th. So
okay,
from that point, there's no more.
We asked that at our meeting yesterday with the phone call, and they recognized the 18th. They anticipate the governor will extend it at least through the end of May. So, and it might be one of those rolling things through the end of May. Then it depends if we're still in phase one. He might extend it further. They didn't say that, but that's what I would imagine. But we do hope to see that through the end of May to provide opportunities to continue.
right.
Meeting.
And as a follow-up, you know, Margaret, you asked on Tuesday, you know, things that we might be interested in. Bill, you did too, in taking a look at. I think we have a real opportunity here. I understand that staff is very busy. I understand that council is very busy. Several of us are still maintaining and running businesses and professional lives. I know Margaret, you and Malin are very busy with trying to see to it that minor league baseball is up and going, and the other boards and commissions, and Margaret, you with the social services. So I understand that everyone is busy, but we have a prime opportunity to meet and to have as much information put in front of us so that we can make those best decisions about our budget and about our scope of work as a community. The farmers market, Bill, when do you think hours will open? Johnson Cities is opening this weekend.
Once we get into the manager's comments, Terry Napier is going to address that, and Tim Beavers is going to address the East Cedar Street project.
Great. And then I know, Chad, you had wanted to hear from Tom Anderson. I'd like to hear from him too. What was it, Chad, that you wanted to hear exactly?
Well, I mean, it really revolves around, you know, housing is what I had mentioned, but you know, the plan that we have right now throughout the Volunteer Parkway, you know, looks at mixed use type opportunities and areas that we can give incentives, mostly along the lines of a pilot and how we're going to structure that. But, you know, I think we've got opportunities. Margaret has mentioned low income housing before. I think we have opportunities in other areas of the city that, for instance, I mentioned the area going down State Street, maybe off of Broad Street, you know, older areas that where you have housing that maybe doesn't have any historical type areas, but it's areas that could be used for new housing, potentially, you know, something along those lines where, you know, housing in different price ranges, as well as, you know, what ideas do we have, for instance, let me say this, for housing in all price ranges. We know we have a need for housing above $250,000, you know, probably between that 250 and 350 range, maybe 400,000. We have lower income housing needs as well. We need housing really in all areas. You know, our spot has been usually 225,000 or lower. How can we, you know, we've been talking about how can we incentivize all of these areas, and I just want to, I mean, in essence, brainstorm and talk, you know, about areas that we could work.
I agree. And I think we have a great opportunity in front of us with the discussion about trying to onshore more and more industry into this country, and to be prepared and to have a plan for housing and for redevelopment. I do know that there are some developers sitting on the sidelines waiting to see what we are going to do out the Volunteer Parkway, and are anxious for us to make some determination. So I think it would be good to, while we can have these meetings, especially to have that opportunity.
Also, updates on what we have heard from the state. We have, for the last several months, we have said that we are going to approach those at the state level who can look at ideas that we have, let us know if it will go or not. If it won't, what can we do? And I have approached them. I know Vince has approached them. I feel like Lee and Malin and Margaret, all of us have approached them, and I'm sure that I'm almost positive Danielle has as well, and Bill, and others as well, and probably Tim as well. So I haven't gotten any response.
We haven't either. We haven't, Dad. Danielle has reached out to the comptroller's office to in asking for an opinion on the issue that you brought up probably last fall now, or at least late winter, about a particular model of incentivizing certain residential developments, and she hasn't received a response. Danielle, would you like to speak to that?
I don't really have more to add than that. I've sent an email and a follow-up email and haven't gotten a response yet. So it may be that there's just been a lot of other stuff going on to focus on, but that's where I am with that question.
My opinion, that's for me. If there's no response, then we proceed in what we think would be a good fashion. And also we talked 2 or 3 months ago about relaxing certain regulations that others in our area have not been implementing. In particular, it's our stance on the I guess it's the heating codes. Excuse me.
It was the insulation, Chad. I think you were talking about the insulation.
Yeah, well, it's also it's pretty. Yes, the insulation, but it's also it's how they have to test the homes
right.
for certain energy. And listen, I think we're all on board. We want really well built homes, and that's great and all. But the problem is it does throw us into a different price category when we're trying to compete with other areas. We have other areas of the Tri-Cities that are building on consistently and have been for the last several years, and we've got our hands tied because we have regulations that they're not adhering to. And let me say this, there are regulations that the state is not asking them to adhere to.
That's probably the subject of another meeting then. I know staff has done some research on that, but that discussion is probably the subject of another meeting.
Right.
I think that's what's being asked, is whether we could spend some time, and just if we're going to talk housing, I think we need to see how it could be structured. It might take a little thought, as well as a little bit of staff time to figure out how best to identify what are the different issues that are being heard from our council and that we've covered in the past, some of them that have come up, and getting that lined up with an agenda to be able to have that as a work session, presumably. I'm
all for that. All of these things dovetail together. We have been saying this for the last 2 or 3 years, and we've done nothing. So we said 2 or 3 months ago that we were going to look at the regulation in another 2 or 3 months. It's 2 or 3 months. Those regulations need to be either we need to have something done about
it any time
if we can.
You can roll those back at any time. We gave you all a housing study probably 2 years ago. We can bring that back and give you that again. That was an internal study done by our planning department. They can provide that again. We have asked the comptroller's office regarding legal interpretations of what we can do in terms of incentives. We have not received a response. We can certainly have as an item on our work session an opportunity to revisit the energy code aspect of that. When that was brought up a couple of years ago, if you'll remember, Carl Cooler, our building inspector at that time, walked through all of that from you all. We received no direction on anything beyond that.
I mean, if I could make a motion right now, I'd say let's drop the energy code.
I think that the question was made, can we do something differently? Staff is prepared to answer that.
What's everybody else?
And you can do whatever you want to do with the energy codes and the building codes. You all can do that. I think you probably need a session much like Carl provided at that time, because it's all interlinked. It's not just one single aspect. I think you need to look at the entire building code that we follow, and then if you want to amend part of that, you can do that.
I think, Chad, it would be appropriate if we did that kind of work session and then follow that with prepared resolutions or ordinances or whatever actions we would need to take action on. So I think even though we have talked about it, and I would say in defense of, we have not had business as usual by our city or our state or county or anyone since probably late February. So trying to follow up with things now, we're getting where we hopefully things are settled enough that we can get back to picking up some things that were put aside, whether purposely or just because everything was put aside. So
that I will say that with my conversations with some of the state, I don't think that we have given them an actual plan of here's what our plan is, and here's where we're looking to, here's how much we're wanting to incentivize, where that money is going to come from. That is, I think, what they are waiting on for us to give us a decision of, and that there again, that's just from my conversations of that we need to have that. Here's what we want to do. Here's where the money would come from, and send that to them. And they're going to say, yes, you're fine, or no, you cannot. But I don't believe, we don't have that together yet. And
Danielle,
Danielle, would you like to speak?
I think Danielle was probably specific with the comptroller. Danielle?
I feel like we asked a fairly specific question, Councilman Turner, and I'll be happy to forward you the email, because what we asked was, here are 2 paths that we are interested in finding out whether it's legal to pursue them.
Right.
If you have any suggestions? And so if they need more details, obviously we can come up with details of a further plan, but I think my approach is, if it's not legal currently for us to take either of these approaches, then spending a lot of time coming up with a plan is wasting time.
right.
So having fleshed out, I think, enough for them to be able to say, yes, this is permissible, or no, this is not permissible. So as I said,
Then I'll follow up with,
okay.
I'll follow up on that. If you want to, Chad.
I'll let you do. I'm not getting anywhere, Vince. with
Okay.
anybody.
That would be good, Councilman Turner, if you could do that. Like I said, our city attorney sent a pretty thought out type proposal to them.
I'm just saying of what
And
my
resent.
last conversation
Had a response.
it's been a few months ago. I guess 3 months ago was the last conversation. So if you'll send me that, I'll follow up on it.
I will.
And
My
I
email,
had a couple of emails since your meeting in Nashville in late January.
Okay.
so one of the purposes of the email was to sort of flesh out the conversation that you'd had back in January, and to
Okay.
say, here's what we're thinking about. And so
Okay. Perfect.
again, more detail, we can provide it.
Okay. Perfect.
Danielle, you would include me on that email as well. In my conversations, I'll just break it down pretty simple, is that it would be to our advantage to send them whatever our thoughts were, throw it up against the wall and see if it sticks, quote unquote. And the point of that is that they understand that right now we are all having to be extremely creative as to how we go about doing things. We of course, we want things to be within the realm of legality, and no doubt about that. But is there a way that the state, if they receive some of our ideas, whatever they may be, predominantly from staff, it may be that others on council have some thoughts and ideas, but if they receive that, how could it be crafted into the realm of legality within the state? And that was part of the conversation, is that they're not there to come up with the ideas, they are there to legislate the ideas. And I know that you've sent the email, and I appreciate that, and I appreciate your efforts. But to build to the point about the housing study that we had done previously, you know, as you pointed out, then Sheriff had done a great job on that. But is it relevant today? I will tell you that I know firsthand that the housing market here has changed even from then. We are entering into a housing market that is not so terribly unlike what we've seen in Nashville, in that houses go on the market one day and there are contracts, multiple contracts the next day. I know that for a fact. And the sweet spot for housing right now, according to several realtors that I've spoken with, is 125 to 250 is the sweet spot. Anything below that is usually scooped up as rental properties. There's a lot of properties here in Bristol that are in desperate need of rehabilitation or to be taken down. Is there a lot of opportunity for low-income housing? We have a lot of people that have rental properties that are at minimal standard and are being paid a premium price for them. And so our housing situation, we are losing residents to the surrounding area because of our lack of inventory at all levels. And that's fact. That's not, oh, I heard, or this, that, or the other. That is fact amongst our realtors. So we really do need to get on with this, and sooner rather than later. And as we have this time to meet, you know, I would encourage you to do that.
I would suggest then, Councilwoman Powers, that our planning staff take that base document that was done 2 years ago now, probably, and update that.
Right, they got to update numbers.
City Council. I know there was a considerable amount of it was a lot of dialogue with the real estate community in the development of that. I mean, by its very nature, there had to be. And I think you're probably right. The markets have changed. The markets may have even changed in the last 6 weeks too, from that matter. But I think it would be good to have our planning staff then take that basic document and revisit with the real estate community, update that document where it's appropriate, and bring it back to City Council to share.
I agree with that. You know, Bill, when that report first came out, while it was very well done, I guess my question in all of that were the statistics that were driven on, yes, there was housing here, yes, there were properties here, but they were not necessarily desirable properties because of the need for rehabilitation. And so I think we have to look at the fact that we do have properties here, to be fair, but the degree of rehabilitation that some of them require do not make them attractive opportunities. As a matter of fact, I would be interested to see how long some of these properties that are included in a housing study have been on the market. And I think that would be very telling, because once a property is on the market over a period of time, you know, I think it's obvious that it's not something that is suitable to be included in that housing inventory if it requires gross rehabilitation. I would just like for us to keep that in mind in looking at anything moving forward.
Right. Also, I think it's important when we talk about housing, it's difficult to figure out, and hopefully there's some appropriate terminology when we say low income, when we say affordable, that in our minds, different people may have different concepts of what that is. And I think probably a huge part of what we're trying to say is the middle income folks that are looking for that 125 to 250,000 that also is probably a huge part of the market, in addition to HUD defined low income housing. Trying to figure
the HUD reimbursement is substantial, Margaret. You know that, and I think everyone on council now, I can appreciate bearing it in mind, but we've all been on this road for a pretty good while now, and I think we do have a good understanding as a council. So I would just sooner better than later. I mean, we've debated this to death.
Well, Danielle had given us some really good information. And by the way, include me on that email too, Danielle. Probably I'll send it to all the council.
Yeah, she's sending it to everybody.
But I thought it was really good information as far as what our definition, or let me say this, what our best guess is low income housing, what that pricing threshold was, and what we define as someone who would qualify for as low income that would qualify for help like that. So I think we've got some really good guidelines that we've been given to us, in that price category. Now going a little higher than that, as we talked about, above 150 or 175,000, once we get above that point, then it gets in a little bit of a different situation, different price categories. But the truth is anything in that $250,000 to $350,000 range is what Lee was mentioning, is going on the market one day and it's got several offers the next.
So, okay, let's let Mr. Sora and Mr. Beavers talk about this, and Tuesday can provide the best timeline, with understanding the sooner the better, but try to look at what it takes time-wise to get new figures, et cetera, and then get back with us for setting a date to have a work session that will be at least major item on it would be to talk about housing. Does that sound okay, Mr. Sora? Okay. All right. Any other updates? We were hoping to finish up today.
We do have one outstanding issue. Since Sullivan County has issued public health order number 3, I think it's my suggestion that we issue executive order number 6, I guess now, Danielle, that would terminate public health order number 2, and then we just leave it alone at that point. We'll indicate in that termination of the declaration that public health order number 3 has been issued by the health department. It aligns with the Tennessee pledge and also the governor's executive orders. Essentially, we're now one of the 89 counties. And so there's no reason for us to have a declaration doing anything any different than the other 93 counties. We're following the governor's orders. So we simply issue an order terminating the declaration of emergency with the statement that will follow the Tennessee pledge and the governor of Tennessee's executive orders.
Okay. And if anything changes between now and Tuesday, we can, if there's anything we need to do differently.
We can always issue a declaration, but at this point, since we're not different from what the governor's office is recommending, there's no point in us having a declaration. We'll just follow the governor's directives.
Okay.
So we would just let the declaration at hand die.
Actually, we'll terminate it.
Terminate it. No.
Okay, and you were going to give us a brief update on Cedar Street, I think, also. Speaking of things that might have been on our agenda for a while.
Yes, Tim.
All right, hopefully everybody can hear me.
Yep.
Spoke with the state earlier this week on East Cedar Street. They have all the documents they need from us and have released it to the feds, the Federal Highway Administration, for obligation of funds. They say that the feds have been obligating those fairly quickly. We hope to hear something next week on be able to bid the project. So cross your fingers that the federal government still makes those turnarounds fairly quickly, and hopefully next week we can have some good news to proceed with bidding the project.
That will be good news, and I think we all will want to dance in the street for that one and get some past council members and past city managers, and it's been a long time, so hopefully we'll see that celebration coming soon. So, and thank you, Tim, you and your staff that have had and it's only going to just start, but through this process, trying to nurture it through and answer the state's questions and provide information. So appreciate it.
Thank you.
All right, Mr. Sora, anything else?
Do we need to make a motion of terminating the current order, or you just terminate it?
That can be done by the mayor and the manager.
Okay.
To terminate.
But we do have an update on farmers market from Terry Napier.
Right.
So yesterday we rolled out a link on the farmers market website with a list of 16 farmers, producers that set up at our market who have listed their phone numbers. And so people can call them and make arrangements for meats and the things that are available. Remember, it is very early. There's some onions and some greens and several of our meat vendors. So we've got that at this point. We have been in pretty constant contact with the other markets, with Johnson City, with Kingsport. Johnson City is very apprehensive about rolling their market out this weekend. So we're watching them to see how that works. And then at the same time, Mike and I met again yesterday and walked through what would be our recommendation when we decide to open our market. I think the biggest thing is we're going to have to do it someplace else, because we're going to have to spread folks out, probably every other parking lot or parking space. So we're looking at probably City Hall parking lot where we can have more room and spread folks out more. It's still across the street from where we've been. So what does that look like? How do we control it? How do we, do we require everybody to wear a mask? Vendors all wear a mask, customers all wear a mask. Who sanitizes the tables? They're our tables. How do we do all those things? So, like I said, we're watching Johnson City to see how theirs works this Saturday. And hopefully we can learn from that, and we'll talk to them on Monday and see what worked, what didn't work. We'll have a plan in place when it's appropriate. I don't know when that is. We talk to our farmers regularly. They're in step with us. Some have told us that, of course, we have a lot out of Virginia. Some have told us we don't want to set up yet. We want to follow the orders and be safe. Some have told us we want to set up yesterday. So we're trying to do everything we can. Like I said, we rolled out the list that we'll update daily, where they can call, and the farmers are more than happy to meet people and sell what they have. So that's where we are right now, trying to put together the next of our plan.
So we hope that things. Go ahead, Vince.
Do you see, or are you hearing of some of these farmers that we've had in the past going to the other areas that have going to Johnson City, or do you think that we will lose some of those if they start going to other markets if we're not open?
I don't think so. I mean, some of our bigger producers do multiple markets anyway.
Right.
So I don't think that's an issue. And remember, we're very early. I kind of chuckled yesterday. A lady had posted on Facebook, looking for tomatoes. We're not growing a lot of tomatoes in Sullivan County right now. Right. So there's some greens, there's some onions, and what Mike's telling me is, everybody's not at the production level they normally would be. I mean, this has been a strange season. Right. So there's not a ton available. Now, our meat vendors, obviously, they can butcher on a cycle, but most of those already advertise their numbers, and you can call them at any time and get your beef. Right. Same with our folks that have eggs. So I don't see an issue right now. And like Mike stays in contact with those folks. I think he's talked to them a couple of times in the last week. And as we see, more produce come in, obviously that's going to push us to do something else. This system of calling is working really well for Abingdon, from what I understand. They've had it out for a couple weeks. Abingdon does have, they have some growers that use hoop houses and hot houses and have a little bit more year round. So they did start this several weeks ago, and it's working. Johnson County opened their market 2 weeks ago. Johnson County only has 3 or 4 vendors. It's really easy for them to spread out. So, we want to open. We want to be safe. So we'll look at the alternative locations and how we can spread people out and how we control that. We've kind of been waiting to see where we finally land on, who should wear a mask, who shouldn't wear a mask, and all those things, because, we're putting our employees, we're putting our staff right in the middle of this. So we make sure that we're online with what's going on. Like I said, Johnson City will be a big learning opportunity for us this weekend.
Great.
Yeah, and I think something that has caused, I know of at least one vendor, if not more, to go to another market is our lack of indoor opportunity. So that last year we were better off than the year before. The year before, I think more than 50% of our market days were rainy days. And it's hard enough for them to get their produce in if it's rainy on Thursday or Friday, getting ready, and then come and be in the rain, even if they're under a tent. It's miserable. It can be miserable for them, and then the shoppers don't come out if it's a bad rainy day. So
we lost a vendor to Asheville because we couldn't provide enough shade to keep his greens and lettuce from wilting.
Right.
So being outdoors is our nemesis.
Right. So again, that's part of how we grow our community and attractiveness, particularly to the younger generation and also retired folks. Also, just a reminder that a successful farmers market is also a social event. So that's where the concern comes. If you shop it regularly, other people shop it regularly, you stop, you talk, you visit, people bring their dogs. And become very friendly with those vendors who then there's allegiance there too. So anyway, well, appreciate it. Appreciate the phone numbers. Also, we'll note besides greens, this is the time of year for plants. So people are selling different plants that are nice to pick up, but it's still very even early with that. So
Carrie, a quick question that I have is, part of the whole coin project, we had hoped that, we could incorporate a farmer's market there. And Bill, this is for you too. We had talked back in the fall sometime about the footers and being placed and being able to put, at some point a raised or covered area over in the parking lot there at the coin building. Could we take a look at what it would take to do something like that? I know that money is not something to be discussed at this moment in regard to that, but I think to have a plan, if that's something that we could do, we're never going to have the farmers market that we all want until we have the correct facility. And we've talked about this quite a bit. So what is our aspiration moving forward? Could we give some thought to that? Not for the immediacy.
I think we were.
Excuse me, Margaret. Not for the immediacy of right now, but in looking forward. Bill, what is your thought about that?
Councilwoman Powers, if you'll recall, I sent all of you an email probably 6 months ago now when Councilman King first brought that up during a work session. And this email was drafted. Essentially, I forwarded you an email from Burwell Construction as they evaluated the cost of those footers. It was going to add another $500,000 to the project, and they also expressed their skepticism due to the finite amount of space on that particular area, that the steepness of access for driving up to a covered parking garage, it was going to be steeper than what is typically found. So there really was not a recommendation for that. But I did send that to all 5 of you, probably.
I remember that now.
October, November.
But if we could give some thought, not for the this immediate time period, but something for us to look at in the coming year, so that, you know, we can have something to aspire to or work towards.
One of the goals, and again, we don't have a lot of money to play with. Please understand, we're going to finish. I predict we'll finish this fiscal year in the red significantly, and we'll model a budget next year that will also dip into fund balance. But one of the goals that for our Parks and Recreation staff is to evaluate areas, not necessarily downtown, but immediately adjacent to downtown that might be suitable for acquisition for that purpose.
Thank you so much, and thank you, Terry. Margaret, I'm sorry.
That's okay. Nope. I shouldn't have interrupted. Okay. Any other comments before we finish up today? If not, I would just reiterate, Lee Powers, what you said earlier is that we're all in this together, and we each depend on the actions of others, and we all work together to move forward. And our best hope is all of us working together. So that's, I think, all of our message to our folks out there is we all want this to be go away, have our new normal. Anyway, but it's independent actions working together to be able to do that. So just reiterate that and push that out. So thank you very much, and we'll see you on Tuesday. So for our regular council meeting. Thanks.
Is it